It's been long claimed that men snore more than women, but is that really the case? About half of people snore at some point in their lives. But according to the American Academy of Sleep Medicine, about 40% of adult men and 24% of adult women are habitual snorers. Snoring also appears to run in families and becomes more common as you get older. Snoring occurs when the flow of air, as you breathe, makes the tissues in the back of your throat vibrate. The sound most often occurs as you breathe in air and can come through the nose, mouth, or a combination of the two. It can occur during any stage of sleep. Snoring can be a nuisance to your partners and anyone else nearby. You may even snore loudly enough to wake yourself up, though in many cases people do not realize that they snore. Snoring can also cause you to have a dry mouth or a sore or irritated throat when you wake up. Snoring can be a symptom of obstructive sleep apnea, but not everyone who snores has the sleep disorder. Obstructive sleep apnea is a serious sleep disorder that causes you to temporarily stop breathing when you're asleep. If you are regularly tired during the day, even though you have had sufficient sleep, or if your snoring is paired with choking or a gasping sound, you may have sleep apnea. Sleep apnea is manageable using several approaches. We talked to Dr. Samuel Moak at Lake Ear, Nose, Throat, and Facial Plastic Surgery to find out more about sleep apnea and what can be done to treat it.
Sleep apnea is a complex issue and an ever-increasing scourge to our population, particularly in the United States. Essentially what it means is that during the night while you're sleeping, there's a disruption in breathing and likewise a disruption in oxygenation of the body. And that causes you to awaken so that you can breathe. So it caused by an obstructive event. There can be different mechanisms at play in that. Most people who have obstructive sleep apnea, it's due to being overweight or obese. But then there's another subset, sometimes within that subset, that it's being caused by something anatomical in the head and neck area, and that's when we come into play. And that can be along the entire upper airway, from the nose down into the throat, down into the voice box, and even certain respiratory disorders can lead to sleep apnea. The most common way that sleep apnea is treated is not with surgery, it's with application of what's called a continuous positive airway pressure machine. Patients can wear that between 5 and 6 hours a night. They're usually adequately treating their sleep apnea. They're helping by applying positive pressure, keeping the airway open. It decreases snoring, and they're able to maintain adequate oxygenation throughout the night. Having moderate or severe sleep apnea, one of the more common things that people present with is daytime sleepiness, fatigue. Sometimes it can increase weight gain, lead to headaches. Those are some of the signs. But a lot of times people don't realize it until a spouse or a partner cues them into it. Sometimes people aren't aware of it. The types of stuff that I can offer for sleep apnea are nasal airway surgery, surgery on the palate, reduction of the base of tongue, things like that to basically open up sort of the upper airway.
For more information on this story, as well as links to the specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Restless Nights story link on our homepage at yourhometownhealth.com.